Of taking the temperature in the armpit or axilla and groin may be used to record the temperature if the patient subject to fits or there is injury to the muscles like fracture jaw. Both the thermometer and the skin must be dry first. You lay the bulb in the armpit, like this, and then fold the arm across the chest. After 2 minutes, remove the thermometer, wipe the bulb, read and record the temperature. Now I will continue about taking the temperature in the rectum. The last is taking the temperature in the rectum. This method is used for babies and unconscious patients of any age. Before you take the temperature, you grease the bulb with jelly. And then insert it into the rectum of the patient. Be careful. And then hold it in right or left seam position. After 2 minutes, remove the thermometer, wipe, read and record the temperature. And then shake the mercury back down, then replace into the antiseptic solutions. Okay, that's all for me about taking the temperature. Thanks for your attention.
Okay, very good, Dada. Now I would like to ask you a question. Dada, my question is when we shouldn't take the temperature in the mouth? When we shouldn't take the temperature in the mouth?
Well, ladies and gents, sometimes we are facing the patient that the patient is confused, the patient unconscious, the patient is child or baby, there is injury to the mouth like fracture jaw, and then the patient is likely to have fits. Okay, that's all.
Okay, what about if we want to take the temperature to children, small baby? Is it good to take the temperature through the mouth or through the armpit? Which one is better?
No, I think the better one is to take in the rectum, because the baby is difficult to when we take the temperature in the mouth.
Okay, so you mean that it is very dangerous if we take the temperature in the children's mouth?
Yes.
Okay, thank you, Dada. Okay, you can back to your seat. Give applause.
Assalamualaikum warahmatullahi wabarakatuh. Firstly, let me introduce myself. My name is Asal. I'm from second grade of Music Academy of KEPANJEN, Malang. Today, I would like to explain about how to tell the sick child and the child with the neck ill. Okay, for the first time, I want to explain about the sick child. When a child is feeling really ill, you realize they're in bed. All you need to do is keep him comfortable in a pleasant surrounding and give him plenty of love and attention when he is awake. At the next stage of illness, you may need to take more active steps to make sure that the ill child is getting enough rest and sleep. It is important that at this stage you provide a lot of entertainment to keep the judgment occupied and his body rested. For example, exhaust, toilet, and as much tension as possible. If the child is sleepy but physically relaxed, you will sleep better at night. when the child is still awake at the night, maybe it is caused by fears or anxiety that may or may not be related by illness. Okay, the next about the night fear. Night fears are common in childhood anyway, but they may be accentuated by illness. The sick child may need more comforting than usual. So when the child gets fears at the night, don't dismiss his fear too easily. Instead, put your head down to his level and look at the room from his angle. Maybe you get a surprise. Night light can cast dramatic shadows which look extremely threatening. Moving the light usually remove the cause of fears and shadows. Reassurance and understanding together with a father are probably the most soothing way of helping him to sleep. Okay, I think enough for my explanation.
Okay, thank you. Now it's time for me to ask you a question. Okay, Azharul, what do you need to do when you get a sick child? I mean here when you find a sick child, what you got to do?
When we get a sick child, we must keep him comfortable in a pleasant surroundings and give him plenty of love and attention when he is awake.
So by doing that, you are sure that the child will get recuperation. Yeah. Okay. Thank you. Okay. Give applause.
Good afternoon, ladies and gents. My name is Dian Kusumawati. I am from 2nd grade Nursing Academy of Malang Regency. Now I am standing here to explain you about account the vitality. In modern life, already find it new thermometer disposable. Although not as accurate as generally clinical thermometer, this thermometer is more safe and more easy to use, especially suitable to child and baby. This thermometer has two kinds. First, the thermometer that plays in the mode for 2 minutes, and the dot that representative of the temperature changes color. And second, the thermometer that has a shape of the strip and placed in the forehead for 15 seconds, and the pen that representative of the temperature changes color. And after use, this thermometer can be discharged. Now I will continue about talking the pulse. Every line, heartbeat, it pumps of blood into the circulation, and the wave courses along the wall of the artery, and this wave is pulse. In the young baby, pulse is 140 a minute, but during a childhood, this rate gradually falls. And in the normal adult, pulse is 60 until 80 a minute. And many conditions that influence of pulse, for example, exercise, emotion, and the other heart disease that must come up. And you must use a watch to account the pulse. And the best place or place that more easy and more accurate to account the pulse at the worst, just above the crest on the thumb side. And if you want to count the pulse, sit the patient down, or patient can sleep, and place your fingertip. Don't use your thumb because your thumb have pulse oven, so you risk a mistake. Please place your fingertip over the pulse and feel the pulse, and then you can record. Okay, I think enough about pulse, and I will continue about respiration. Respiration consists of breathing on and breathing in. In the normal adult, respiration is 16 until 18 times a minute. A person's respiration can be altered if he wants breathe more slowly or more quickly. And one person, no, you won't count the respiration. So his respiration will be difficult for him not alter the respiration. So the best time to account the respiration if the patient sleep. And patient must not unaware what are you doing. You can sleep. You can stand up in the bedside, and then you can account the pulse. After this, you can continue account the respiration. Okay, I think enough about my explanation. Thanks for your attention.
Okay, it's very good. Now I would like to ask you a question. Dian, how is the way to account the vital sign that easier and more simple?
Okay. Another way to account the vital sign, especially pulse, that more easy and more simple. We can account 15 seconds and then we can times 4. But this condition or this way not used to child or baby or to patient that have heart disease that must happen because they have pulse that not regular.
Oh, I see. Okay, thank you, Dian. It's very good. Give applause to Dian.
First of all, let me say Assalamualaikum warahmatullahi wabarakatuh. My name is Mrs. Jennifer. I am second grade of Nursing Academy of Malang Regency. Here, I would like to present about communicable disease. You know, caring for the patient with communicable disease is very important to accelerate the recovery process. Each disease is liable to cause complications that some of which are mild and some of which may be serious. Your aim in caring for someone with communicable disease is dual. First, to provide the nursing care, and second, to prevent the spread of infections. Part of caring for someone with communicable disease are nursing the patient, containing infections, and immunity. Nursing the patient. The type of care that you will give to a person with communicable disease is depend on the severity and seriousness of the illness. For example, a child with a mild attack of German measles can be kept away from school for a few days and need a little nursing care. An adult with a serious of the illness will be admitted in the special isolation of the hospital and they will require intensive medical and nursing care. In such hospital, elaborate precautions are taken to control the spread of infection and to protect staff from infection. Next, about containing infection. As a nurse, we always connected with the patient, so we must attain several precautions to help prevent the spread of infection. There are several precautions that we can take to help prevent the spread of infection. First, nurse the patient in a well-ventilated room where possible, with a window open except when he is being treated or bruised. Second, any food left on the patient plate after he has finished it should be removed and disposed quickly. The third are the pants and urinal should be taken in the lavatory immediately after he used and weak. And the fourth, use a clear balance spray to keep the bedroom and the lavatory from fleas and insects. Ladies and gents, for the attentions, you must be careful not to transmit the spread of infection by wash our hands before and after you attending with the patient, or after you have finished to change the linen of the patient, send to the laundry as soon. The last about immunity. Immunity can be described as a kind of substance or antibodies that produce in our body to keep or protection in our body from infection or the illness. The type of the immunity are innate immunity and adaptive immunity. Innate immunity is non-specific as the body first line of defense, protection against, and adaptive immunity adaptive immunity is stimulated against when the pathogen enters the body. Adaptive immunity divided into active accurate immunity and passive active and passive accurate immunity. The active accurate immunity can be given by immunization. I think enough about my explanation. Thank you for your attention.
Okay, thank you. Liz, now I would like to ask you a question. Now, if the family doesn't know about the treatment of the disease, how can you explain since you are the nurse here?
I think firstly we must explain to the family that the disease is the outcome of the generalized infection or inflammation, and then we give to know about the several precautions. For example, eat well and avoid becoming overtired. Wear a low smoke to protect your clothes. Keep the visitor minimum. Turn away if he coughs or sneezes.
Oh, is that all?
Do not allow children near to the patient unless the doctor says it's safe for them.
Okay, thank you. Liz, it's quite clear. You can back to your position. Give applause.
Good afternoon, everybody. Today, I will explain to you about the anatomy, especially about the male pelvis. But firstly, I will introduce myself. My name is I'm in second grade nursing academy of KEPANJEN, Malang residency. Now, let me start to explain about this anatomy. I will mention each part of this organ. The first is prostate gland, that will function to produce hormone, and then number two is sinus pubis, that will function to protect an inside organ, and number three is rectum, that will function to pass the feces. Number four is urethra, that will function to pass the sperm and the urine. And then number five, bladder. In here, urine will be kept. And then number six is corpus cavernosum. Number seven is corpus cavernosum. Number eight is testis. In here, the sperm will be produced, and the testis have function to produce a male hormone. Testosterone hormone, and then number 9 is epididymis, that function as a tract of the sperm, and then number 10 is ductus deferens. Number 11 is a seminal vesicle F2 right and left under the bladder. This is a component that more important to produce the sperm. And then the last is ureter. Now I will explain more about this anatomy. The location of prostate gland is posterior to the symphysis pubis and in front of the rectum. And the urethra pass through the prostate from the bladder. It leaves pelvic cavity to enter and pass through the corpus spongiosum. The corpus cavernosum placed above the corpus spongiosum. And then the testis in the scrotal side passes its sperm into the epididymis. In here, the sperm will be stored. And then later, the sperm enter into ductus deferens to unite with the fluid from the seminal vesicle. And prostate finally enter the urethra. And then the ureter from the kidney valve passes posterior to the bladder to enter its wall and crossing the ductus deferens. I think that's all for my explanation, and thank you for your attention.
Okay, Puji, it's quite clear your explanation. Now I would like to ask you a question. What kind of disturbance that may happen in a prostate area?
Okay, I will try to answer your question. The disease that can disturb this area, you can say BPH or benign prostate hypertrophy.
Okay, it is one of disturbance that may happen in a prostate area, yeah?
And it happens usually in old men.
Old people, you mean?
Yes.
Okay. Okay, thank you, Puji. I think that's all my question, and you can back to your seat. Okay, give applause to Puji.
My name is I am the second grade nursing academic of KEPANJEN Malang. And in here I would like to explain about the anatomy of the female external genital. The female external genital is the part of the reproductive organ of woman. Is very important. Okay, I will start now. The female external reproductive organs are illustrated on the right side by a deep dissection. The first, labia minor, are dissected to show the opening of the urethra and vagina para into the common region between labia called vestibule. On either side of the labia are vestibular gland. On the left side, a superficial section showing the bulbous cavernous muscle, which surround the vestibular gland shown on the right side. On the left side, an ischial cavernous muscle, which cover crush of the clitoris. Both crush on either side to form the single midline of clitoris. And then the perineal body. The perineal body of perineum lies between posterior opening of the vagina and anal orifice, and then the levator animascule. Levator animascule can function to support the pelvic floor and attaches posteriorly to the coccyx, surround the rectum, and form the outer sheet of the vagina. Notice that the pulvulator gland have a duct opening into the labia minora. I think my explanation is enough. Thanks for your attention.
Okay, thank you. Now, I would like to ask you a question, Teguh. What is the function of levator animascule?
The levator animascule can function to support the pelvic floor and attaches the posteriorly to the coccyx and surround the rectum and form the outer sheet of the vagina.
Okay, thank you. It's quite good. Your answer. Okay, thank you. Back to your seat. Give applause to the
Good afternoon, everybody. Allow me to introduce myself. My name is Dr. second grade student Kesehatan with KEPANJEN, Malang. Today, I will do explanation about clearing blocked nose. Let me start now. If the patient upper respiratory passages are blocked or need salting, they may be salted and moistened with the help of strain inhalation. These are made by using a drug and with the water. Ladies and gentlemen, several different drugs may mix with the water and with depending on the patient need. A variety of drugs reduce inflammation in the trachea and bronchi. Inflammation in the location we call bronchitis and tracheitis. Ladies and gentlemen, menthol, eucalyptus, and camphor help to clear the air passages by shrinking the mucous membrane lining the nose and sinuses. Which drug we use and in what quantity will depend on the instruction given to you by doctor and health professional. The other methods to clearing the nose, you can use a spray can be squirted into the nose or nasal. And then I will explain about keeping strain inhalation. The equipment are a trap, sputum cup, and then tissue, a bowl, a thick cover for the jug, and then a large jug. And then first, pour the water into the jug. Don't fill the jug more than 2/3 full. And then place the equipment on the tray, and then the patient should breathe in through his mouth and out through his nose. Ladies and gentlemen, if the patient in the bed, we can place the equipment in the tray in front of him, and then if the patient in the chair, we place the equipment in small table in front of him. Okay, I think that's all for my information. Thank you for your attention and good afternoon.
Yeah. Okay. Thank you. Now, Hester, I would like to ask you.
Yes.
Actually, how is the good position to give cleaning blocked nose for the patient?
I think a good position for the patient is a semi-polar position.
Semi-polar position. Yeah. Why?
because the semi-pole position can make easy the patient to do the treatment.
Oh, to get the treatment, you mean? Yeah.
Yes.
Okay, thank you, Heston. You can back to your position. Give applause to yourself.
Good afternoon, everybody.
Good afternoon.
Firstly, I want to introduce myself. My name is Jen Kaladuni. I'm from 2nd grade Nursing Academy of KEPANJEN, Malang. This time, I want to explain about the oxygen produced in the home and changes of oxygen. Okay, now I start from oxygen produced in the home. Ladies and gentlemen, many patients with chronic chest or heart complaint are helped by being able to breathe oxygen when climbing start or moving about. There are several kinds of portable oxygen cylinders. Portable oxygen cylinders each supplied with a solder strap and carrier cage. They weigh between 5.5 lbs and 12 lbs and hold from 100 to 500 liters of oxygen. The patient is also supplied with a patch and a face mask. Portable oxygen cylinders can be far from an ordinary oxygen cylinder. The procedure takes about 12 minutes. This is picture of portable oxygen cylinders. Okay, now I will continue about the dangers of oxygen. Ladies and gentlemen, whether oxygen is used at home or in institution, the dangers are the same. The light sparks such as from a mechanical toy. Fire spread with irritating activity and a glowing cigarette, causing an explosion in the presence of oxygen. Grease or oil should not be used on the valve or flow meter and should not be touched with greasy hand because may ignite spontaneously and causing an explosion in the presence of oxygen. If you're dealing with oxygen, you should be safe, no spark, no smoking, and no grease or oil. Okay, I think it's enough about my explanation.
Okay. Now I would like to ask you a question, Major. Why grease or oil shouldn't be used on the valve or flow meter?
Because grease or oil may ignite spontaneously and causing an explosion in the presence of oxygen.
So it's very dangerous, yeah?
Yes.
Okay, thank you, Icha. You can back to your position. It's good. Give applause.
Good evening, everybody. Let me introduce myself. My name is Dr. Widya. I'm from 2nd grade Nursing Academy of KEPANJEN, Malang. In here, I want to explain about fever and AKPER. As a nurse, we should know how to tell when the patient has a rise temperature, and we should also know what measure it is normal. It's important to keep the temperature under control to promote recovery. The first patient is hot, precious, has ice, and probably sweating. He may complain of headache, have a dry mouth, and feel pain. And in here, I want to explain about applying a cold compress. First, we must prepare the equipment. The equipment there is small plant, surfing, and shower, both containing the water. And the implementation, first, we take and soak the towel in water like this. After that, we bring the towel and the spring to avoid warming up in the center. And last, we apply the towel
to the patient forehead, and weaken when it is necessary. I think it's enough my explanation, and thank you.
Yeah, okay, thank you. It's very good explanation, yeah. Even actually it's very short, but it's okay, it's quite clear. Now, I would like to ask you a question. What are your priorities if you meet the favourite patient? What you got to do at the first line?
To send for him, the priority are to make his spirit color, and we can to clean the mouth, and we can to deal with his headaches.
Okay, thank you. Your accent is good, and you can back to your position. Okay, give applause to your friend.
Good evening, everybody.
Good evening.
My name is Imam Wazir. I am student in Nursing Academy of KEPANJEN, Malang from second grade. Here I would like to explain about the control the cough, and then relieving asthma and hiccup. And then relieving and helping the breathless patient. Firstly, I would like to explain about the control cough. We know that cough is a protective mechanism, it's the body's way of clearing the air passage. We can fight the